Welcome to our channel. Today, we will address an extremely important topic, the causes of dizziness. Have you ever felt dizzy without understanding why? Have you ever experienced that feeling of imbalance, dizziness, or sudden confusion? In this video, we'll explore the 8 main reasons behind dizziness, providing an in-depth look at each one. But before we dive into this essential content, we would like to invite you to subscribe to our channel and activate the notification bell. Why? Because understanding the causes of dizziness can make all the difference in your life or the life of someone you know. Dizziness can be an alarming symptom and is often a warning sign of underlying health problems. Follow every detail of this video, as the information we will share can help you identify and deal with this condition more effectively. So sign up now, and let's explore this important and enlightening topic together. 1. Problems in the internal labyrinth. Problems in the internal labyrinth, or inner ear, represent one of the main causes of dizziness. The internal labyrinth is a crucial part of the vestibular system, responsible for balance and spatial orientation of the body. When disorders occur in this area, such as benign paroxysmal positional vertigo, Meniere's disease, or labyrinthitis, the vestibular system can send conflicting information to the brain about the body's position, resulting in sensations of rotation, imbalance, and dizziness. Benign paroxysmal positional vertigo, for example, is characterized by sudden episodes of dizziness when changing position, often triggered by the presence of small crystals in the internal labyrinth. Accurately diagnosing these conditions and implementing appropriate treatments, such as repositioning maneuvers, medications, or vestibular therapy, can help alleviate symptoms and improve the quality of life of those affected. Therefore, understanding the problems in the internal labyrinth is essential to effectively dealing with dizziness related to the vestibular system. 2. Orthostatic hypotension. Orthostatic hypotension is a common cause of dizziness that occurs when a person quickly changes position, such as when getting out of bed or a chair. This is because the body takes time to adjust blood pressure when we go from sitting or lying down to standing. In individuals with orthostatic hypotension, this adjustment is inadequate, resulting in a temporary drop in blood pressure and, consequently, symptoms such as dizziness, blurred vision, weakness, and in extreme cases, even fainting. Causes of this condition may include dehydration, medication side effects, neurological disorders, or problems with the autonomic nervous system. Treatment generally involves measures such as increasing fluid intake, avoiding sudden changes in position, and adjusting medications, if necessary, under medical guidance, in order to prevent recurrent episodes of dizziness. 3. Dehydration. Dehydration is a significant factor that can trigger dizziness in many people. This is because water plays a key role in the functioning of the body, including maintaining blood volume and blood pressure. When we don't drink enough water or lose fluids due to intense physical activity, hot weather, or illnesses that cause vomiting and diarrhea, our bodies can experience a reduction in blood volume, which leads to lower blood pressure. This can result in dizziness, weakness, mental confusion, and in more serious cases, fainting. Therefore, it is crucial to stay hydrated throughout the day, especially in situations involving excessive fluid loss, to prevent dehydration and its associated symptoms, including dizziness. 4. Neurological disorders. Neurological disorders represent a broad category of conditions that can lead to dizziness due to dysfunctions in the nervous system, specifically in the regions responsible for balance and coordination. A common example is migraine, in which headache episodes may be accompanied by dizziness, nausea, and sensitivity to light and sound. Additionally, central vestibular disorders, which directly affect the brain's vestibular system, can cause persistent dizziness and imbalance. Secondary neurological problems, such as dizziness, may also occur in conditions such as multiple sclerosis and brain tumors. Careful evaluation by a physician is essential to determine the exact cause of dizziness and to develop an appropriate treatment plan, which may include drug therapy, vestibular rehabilitation, or specific interventions depending on the diagnosis. Therefore, understanding the relationship between neurological disorders and dizziness is crucial for effective diagnosis and management of these conditions. 5. Medication side effects. Medication side effects are a potential cause of dizziness that deserves attention. Many medications have adverse effects, and dizziness is a common symptom that can be triggered by a variety of substances. This includes blood pressure medications, antidepressants, sedatives, antihistamines, among others. Drug-induced dizziness often occurs due to the influence of chemicals on the central nervous system, body fluid balance, or blood pressure. It is essential to report any dizziness to your doctor, especially when starting a new medication, as dosage adjustments or switching to an alternative that is less likely to cause dizziness may be necessary. Healthcare professionals can help balance the benefits of treatment with the risks of side effects and find the best solution to avoid dizziness and other unwanted symptoms. Therefore, being aware of the potential side effects of medications is essential to ensure safe and effective treatment. 6. Low blood sugar. Hypoglycemia, or low blood sugar, is an important cause of dizziness that occurs when blood glucose levels fall below the normal level. This can happen due to long periods of fasting, insufficient carbohydrate intake, or as a result of medications used to treat diabetes. When the brain does not receive an adequate amount of glucose, which is its main source of energy, dizziness, weakness, sweating, palpitations, and even fainting can occur. To prevent hypoglycemia, it is important to maintain a balanced diet, eat regular meals, and monitor blood sugar levels, especially in people with diabetes. Quick administration of sugar, such as fruit juice or a snack, can alleviate symptoms of dizziness when hypoglycemia occurs. Awareness of the relationship between glucose levels and dizziness is essential to avoid episodes of hypoglycemia and ensure stable health. 7. Chronic anxiety and stress. Chronic anxiety and stress can trigger episodes of dizziness due to a series of physiological and psychological mechanisms. When a person is anxious, their body goes into a state of alert, releasing stress hormones such as cortisol and adrenaline. This can cause a range of physical reactions, including increased heart and breathing rates, muscle tension, and constriction of blood vessels. These responses can affect blood flow to the brain, causing dizziness. Additionally, anxiety can lead to hyperventilation, which in turn reduces carbon dioxide levels in the blood, causing feelings of dizziness. Treating anxiety-related dizziness often involves addressing the underlying cause, such as cognitive behavioral therapy to manage stress and anxiety, as well as relaxation techniques such as deep breathing and meditation, which can help reduce symptoms. Therefore, understanding the effects of stress and anxiety on the body is essential for effectively controlling dizziness in these cases. 8. Heart problems. Heart problems such as arrhythmias, congestive heart failure, and hypotension can trigger dizziness due to their direct influence on blood circulation and oxygen supply to the brain. Heart arrhythmias, such as atrial fibrillation, can lead to an irregular heart rate that affects how efficiently it pumps blood, causing dizziness and feeling faint. Congestive heart failure compromises the heart's ability to pump blood properly, resulting in decreased blood flow to the brain. Additionally, hypotension, or abnormally low blood pressure, can cause dizziness due to a reduction in the amount of blood reaching the brain. Early diagnosis and treatment of these heart conditions is crucial to preventing serious complications and managing associated dizziness, often involving medical interventions such as medications to regulate heart rhythm, improve heart function, and control blood pressure. Therefore, understanding the relationship between heart problems and dizziness is vital to protecting cardiovascular health and preventing recurrent episodes of dizziness. In conclusion, understanding the various causes of dizziness discussed in this content is critical to increasing awareness of this condition and its health implications. However, it is crucial to emphasize that dizziness is a symptom, not an isolated condition, and its cause can vary significantly from person to person. Therefore, while these explanations provide a helpful overview, the importance of seeing a doctor for individualized evaluation cannot be underestimated. A qualified healthcare professional can make an accurate diagnosis, considering medical history, physical exams, and additional tests, and develop an appropriate treatment plan to address the underlying cause of dizziness. This not only helps alleviate symptoms, but can also prevent serious complications. In summary, applying the knowledge presented here is valuable to identify possible causes of dizziness, but seeking medical advice is essential for complete and personalized healthcare. We sincerely appreciate you taking the time to watch this video. Sharing knowledge is key, and by sharing this content, you can help friends, family, and colleagues better understand the causes of dizziness, allowing them to identify and deal with this symptom more effectively. If you found this video informative and useful, don't hesitate to share it on social media or with anyone who might benefit. Also, feel free to watch the next video that appears on your screen, as we will continue to provide valuable and enlightening content to you. Thanks again, and see you next time.